Yes.
Hello, I'm Dr. Mahesh. I'm one of the orthopedic surgeons in Prakriya Hospitals, Naxanga. Um, I have been working in the field of orthopedics since nearly more than 20 years now, and I was abroad in England for 15 years. I'm back here in India for 1.5 years. Today I'm mainly going to talk about meniscal injuries in early and moderate osteoarthritis of a knee joint. Okay. Uh, the meniscal injuries in a sports injuries is entirely different from the degenerative meniscal tears in middle-aged people. For example, on 40 to 60, take as at 40 to 60 years of age, they'll have acute knee pain, probably due to unnoticed trauma or minor twist in the house. Uh, as we go along, patient comes with a history of acute pain in the knee, sometimes more, sometimes less, intermittent thing. Some of the patients come with, I can't sleep at night, it's a pin-like pain from the knee joint. So when you have pain in the knee joint, and when you take an X-ray which shows early or moderate osteoarthritis, which still can wait a few years before they jump into total replacements or radical surgery like a total replacement, which is a one-stop solution, I know. Most of the Indian population wants a one-stop solution, and once they come to the hospital, they think that their pain should be completely over. But this is not the way we look at the meniscal injuries in the middle or early or middle stage arthritis or moderate arthritis, what we call. There can be an acute meniscal injury like a degenerative radial tear or even a massive tear within the knee joint just because of degeneration within the knee joint, and some chondral injuries as well within the knee joint to the cartilage. Chondral injuries are nothing but the cartilage injuries, which can be salvageable, and it can prolong your knee joint without pain for at least 5 to 10 years in few patients without going under the knife for total replacement. So what I'm trying to stress upon is, yes, people come to me around 40 to 60 years of age, sir, ನನಗೆ acute pain ಇದೆ ಮಂಡಿಲಿ ತುಂಬ ನೋವಾಗ್ತಾ ಇದೆ, ನನಗೆ ಎದ್ದೇಳೋಕ್ಕಾಗಲ್ಲ, ನಡೆಯೋಕ್ಕಾಗಲ್ಲ, ಸಡನ್ನಾಗಿ ನೀ ಬಿಟ್ಕೊಂಡು ಹೋದಂಗಾಗುತ್ತೆ. So they are not athletes. Athletes are completely different. They are traumatic injuries. These are middle-aged housewives who come with this problem. And the first thing is they'll have, I tell them is to reduce the weight and give some of the physiotherapy, usual static quadriceps and hamstring exercises, and to do them every hour if they can. And every hour they can spend 5 minutes, they can do it. At the same time, reduce the weight, follow a strict diet regime, and go along with that. If they don't get better with these things, then we go for a MRI scan in this middle-aged ladies. We take an X-ray first. It doesn't show massive arthritis, it shows early or middle stage arthritis. Then we go for an MRI scan. The MRI scan shows definitely some amount of chondral injuries and meniscal tears. What we do in these cases is we try to do arthroscopic washout of the knee joint, what we call, just something like cleaning a room. Knee joint is nothing but a room where we inject fluid into it and see what's happening with the camera in one. It's a keyhole surgery, as you all know. There are 2 portals done, one on the other side, one on either side, just hardly half a centimeter incision. We go in with instruments in one portal, and the other portal we have the instrument the camera which goes in. I think you've all seen the YouTube videos. So normally the posterior horn of the medial meniscus is normally the culprit in middle-aged ladies, which causes this problem. Or there can be even massive tears, we don't know. So we go in, and there can also be some chondral injuries as well, like cartilage, what you see the blue color here. We just shave them all like cleaning a room and create a stable edge in the meniscus so that this this radial tear doesn't come into the joint when the patient is weight bearing. Okay, that's what it's something like a pebble in the shoe, which causes the meniscus comes within the joint when the patient is weight bearing. So this is the time when we try to get that out of the weight bearing area so the patient will have a pain-free motion. I'm not saying here that I can take away completely the pain. I can't take away the pain of the arthritis, the bony pain, but I can take away the soft tissue part of the pain, as well as some amount of chondral injuries which I can do some chondroplasty. Or even we go further sometimes in young patients where we drill some holes and get the blood out and try to heal the cartilage with an alternative type of cartilage which forms a pseudocartilage like. It will still function and give the patient a few years before they can go into the knife for total replacement. So this is an interim solution for a patient before going to total replacement. I just going to stress upon it is early or moderate stage arthritis, not complete fully blown severe arthritis. Okay, that is what I am trying to say to the public, that yes, the main advantages are you get some pain relief for some time before you go into total knee replacement, and you don't need a radical surgery, because once we do a radical surgery total knee replacement, like total knee replacement, it's irreversible. Your cartilage is gone and you've got implants inside. But that will stay only for 10 to 15 years according to studies all over the world. But with this interim solution, we can go until 5 or 10 years, even sometimes I've seen patients going up to nearly 15 to 20 years. So don't subject your knee to straight away to total knee replacement until unless you have a massive arthritis. There is still an option like arthroscopy, cleaning out of the knee joint before we go ahead with the total knee replacement. So I would like to stress about, because I started learning arthroscopy in this way, where I cleaned the joint. That was 10 years ago, where the patient used to come only after 2 or 3 years saying that she then has some pain. So we are buying some time here before we go into total replacement. So this is what I need to stress upon. Okay.